Would you like 5 tips on how to lose even more weight on your weight loss injections like Zepbound and Wegovy? I got you. My name is Dr. G, and I'm an internal medicine doctor in Hollywood, Florida. I specialize in lifestyle modification coaching and taking consults on patients taking GLP-1 agonists like Zepbound and Wegovy. 5 tips to get even more out of your weight loss journey on these weight loss injections. I have them right here. These are tips that we've developed over time, not just myself, but just knowing about weight loss itself and optimizing them for this situation. Being on one of the weight loss medications that are now taking over the country, taking over the world, really, GLP-1 agonist medications. So let's talk about it. Tip number 1, change the how, the what, the when, and the why we eat. So absolutely important to look at your nutrition as a whole when you're jumping into this weight loss journey with GLP-1 agonist medications. The macronutrients that you need are very important to calculate your situation before you jump in it. Making sure you are taking in the appropriate amount of macronutrients is absolutely imperative for your weight loss journey, especially on these medications. As we've outlined before, taking in too little or too much of one of the macros is going to wreck your weight loss journey and could even give you one of the dreaded side effects. Side effects like the Ozempic face, nausea, vomiting, diarrhea, all can be a result of taking in the wrong macros, but especially not losing weight appropriately or not maximizing your weight loss on your medications. Don't forget to limit your salt intake, to limit your intake of refined or processed foods and meats. Make sure to increase your veggie intake. Your fruit intake is absolutely important. Also, introducing some nuts and grains, whole grains, into your diet is absolutely imperative to increase your weight loss on these medications. Remember, eating smaller portions is part of the deal. One of the reasons that you became obese or you got into this obese situation, this obesity problem, is because your portions possibly, most likely, is way too much for you, especially with a combination of sedentarianism, meaning sitting on the couch and watching too much YouTube. Putting that together with the portions that are way too large increases your weight overall. So smaller portions during your weight loss and training yourself to understand that these smaller portions are absolutely enough to keep you full. Make sure you eliminate late night snacking. Too many calories too close to bedtime when it's time to wind down is not ideal and actually promotes more weight gain. Also, eating too late will destroy your sleep structure, which is another point that we're going to talk about that you need to optimize. Optimizing sleep is absolutely important. So eating too late can destroy the structure of that sleep and make that recovery time that you absolutely need to improve and maximize your weight loss. Yeah, it'll tear it up. So don't wreck your weight loss journey by eating too late. Ultimately, weight loss is a very simple math problem. Let's take the analogy of your bank account. If you spend more money than you save, your money will dwindle and the bank account numbers will go down and down until it gets to 0. If you save and spend at the same amount, you're saving and you're spending, you're really not going anywhere. You're saving and you're spending. You're saving and spending at the same time, saving, spending, the same exact numbers that go in and out. You're going to be pretty much flat. Your bank account's not going to go up or down. It's just going to stay right where it's at. Eat money in, money out. Now, if you save more than you spend, the bank account will go up, right? Up and up and up and up till you're a gajillionaire. That's the same concept with your calories in and the calorie expenditure. If you are going to work out more than the calories you put into your body, eventually you'll begin to cause your weight to go down. If you eat more than you work out, meaning you save calories and you're not spending them, the weight will go up and up and up. If you're doing the same thing with calories expenditures and calories saved, I mean, you're eating and you're spending the same amount every single day, your weight's not going to go anywhere. It's going to stay on its plateau, on a flat curve. So, very simple. That's the first concept, right? That's the first concept of weight loss altogether. It gets harder, it gets tougher because we bring in other things as humans. We're very complex. We make things harder than it needs to be at times, and our own physiology, our own brains, our own emotions when we attach them to food and when we use food for the wrong reasons, causes our nutrition, causes our weight to go in the wrong direction when we don't want it to go that way. Changing the who, what, when, why. That's the why. Why are you going to food? What emotion have you attached with your food? The only human emotion that food can actually solve for you is hunger. Everything else, if it's anger, if it's frustration, if it's anxiety, if it's loneliness, if it's happiness, if it's depression, all of those things, all of these emotions that you have will not or cannot ultimately be solved by putting calories into your body. Food can solve hunger. Hunger is a real emotion and you feel it, and you should become satisfied at some point with a caloric meal. So those are the tips for optimizing your nutrition. Making sure you're eating the right amounts, making sure you understand what emotional state has brought you to this plate of food, or this, to this place to buy food. Understanding the timing of the food that you're eating it into your body. You don't want to eat it too late. And understanding what you're eating, the macronutrients. You have to have the right proportions of proteins, of fats, and carbohydrates. So that's just tip number one. But that's the best, that's probably the most important tip. Understanding the food equation. The food equation. That's what we're going to call it. Tip number 2, move more. Find ways to find activities, find ways to get off the couch to become non-sedentary but they have to be things that you like, right? Because we're looking for activities that you can do until you're as old as possible, right? And activities that you can move your body for as old as possible. And even then, when we become older, we can change those activities. We can modify those activities because studies have shown, less arthritis, and elderly folks, if they have continue to be active, have an increased muscle mass. The more muscle mass they have, the better they do. Less comorbidities, they die less, less fractures, less falls, better cognitive skills. So it's absolutely imperative to move this thing called your body and move it effectively for as long as possible. So you're looking for any way that you can get up. Maybe if you're at a desk job, make sure you get up every hour. Make sure you take the stairs when you can. Park the car as far as possible in the parking lot. Walk a little bit further if there's, built-in ways to get in some steps during the day. Always, always, always looking for that optimized cardiovascular activity or any type of real exercise for at least 150 minutes a week. That's the low end. Studies have shown that optimized exercise really is at 200 minutes a week. So we're going to start the goal, short-term goals. You're coming off from 0 minutes a week, and you're trying to get it up. We're going to shoot for 150. That's the absolute minimum. But if you want to optimize your weight loss and get the most you can out of your weight loss journey, it's 200 minutes. Get 200 minutes of walking, mix that up with some resistance training a couple days. Make sure it's activities that you like and can possibly do for as long as possible, because this is a weight loss journey. This is a lifestyle modification that we're looking to sustain for the long term. Get moving. Tip number 3, choose healthy habits. What does that mean? Stop smoking. That's like number 1. Stop smoking. Smoking has been connected to a myriad of different comorbid issues: hypertension, high cholesterol, cardiovascular disease, neurovascular disease, obesity, skin, all types of cancers have been connected to smoking. And yeah, people who smoke, compared to people who don't, die more. They die a whole lot more. So if you want to be healthy for as long as possible, the first thing that you can do if you are a smoker is to quit smoking. It's talk to your doctor and get to finding a way to get off and away from tobacco. If you're not a tobacco smoker, if you don't smoke, don't start. Don't ever start. Don't ever start smoking if you want to stay away from all of those comorbid diseases and you want to stay as healthy as possible, right? Now, I know, a glass of wine here and there is not a problem. But if you're an excessive alcohol drinker, then you need to cut that back, right? So ETOH, alcohol, it could be in a form of beer and wine, liquors. You want to keep those down as minimal as possible. I mean, I understand we want to be social, but we want to limit those to less than 2 drinks, no more than 2 in a sitting. that, depending on what it is you're drinking, right? Just has been seen to decrease your amount of empty calorie intake, poor decision making, and wrecking your own diet just because of your poor decision making when you're inebriated or drunk or had a few more drinks than you should have, and you decide, it's a good idea to have this whole pizza. You wouldn't have made that decision had you not been under the influence. So limiting your alcohol intake could also be one of the things to optimize, should be one of the things you optimize on GLP-1 agonists. Thankfully, GLP-1 agonist medications seem to significantly curb alcohol intake for a great amount of people who are on the right dose. But remember, this is not a forever medication, not in my estimation. We're looking to change your lifestyle while you're on these medications. So the lifestyle modifications you're going to make are going to be to keep yourself away from these bad habits when you come off the medications, but you're going to learn that habit over time. So understand that the medications are short-term, holding back your craving for the smoking or the drinking, mostly the drinking. I haven't heard of anything about smoking from any of my patients, but who knows, right? Keep your drinking to a minimum as you are going through your lifestyle modifications. Make that one of your goals if that's one of your issues. That way, you're going to replace that habit with a healthier habit. Another healthy habit that you can modify during your lifestyle modification on these medications that will help and optimize your weight loss. Stay away from drugs. Illicit drugs have been known to, cause, well, obviously it's not great for your health, but can increase your appetite. So staying away from illicit drugs in general is a good idea, but staying away from them during a lifestyle modification journey like weight loss is absolutely helpful to stay away, because you can make the wrong decisions. It can enforce you or actually promote hunger drive a lot more than you would if you were sober. Stay away from drugs. It's just a good idea. Some other things that you could do, healthy habits, managing your stress effectively, meditation, breathing exercises. Mental health therapists, I've talked about this before, should absolutely be part of your healthcare team. Your lifestyle modification team should include a mental health coach or a mental health therapist or a counselor or a priest or whoever it is that you feel comfortable divulging your stressful situations that can give you good advice on how to deal. Increased stress in general, it can increase cortisol levels, which then increase the hunger drive and then can increase weight. So managing stress during a lifestyle modification, just in general, should be something that we are taught to do on a regular basis. And those are healthy ways to handle that. Prayer can be a way to handle your stress. It'd be great if you can incorporate your exercise as part of your stress management therapy as well. So managing stress is important and part of your weight loss journey on these medications. Remember to stay hydrated. Staying hydrated will help you to metabolize, your metabolism to work efficiently. You need water in order to do all these processes of building muscle and breaking down fat that you want to happen on your weight loss journey. So hydration is absolutely important. Your kidneys need to wash all this stuff out. They need to be bathing in water. It covers 70% of the earth. It's probably, it's like 70%, 80% of the body as well. So water's great. Part of choosing healthy habits, important thing that you can do is make sure to incorporate an accountability partner. Someone who is either on your journey or is near to you enough to see you just about every day to know to say, hey, Dr. G, you need to get back on it. You've been falling off. What's going on, brother? Oh, Dr. G, you're doing great. Encouragement. You need some more encouragement, man. You're doing all right. Go ahead and keep it going, man. You're looking great. Those are the type of people that you want to keep in the loop on your weight loss journey or your lifestyle modification journey, whatever it may be. In this case, we're talking about weight loss. So keep these people in the loop. Somebody who can be accountable, especially if they are on the same journey as you are. That's amazing. That means that they're going to go ahead and bounce things off of you that, ideas and their wins and their losses, and you can do the same. The two of you can get further, or three of you, whatever the group is. An accountability group is an amazing place to be. And you can get further with that impetus, with that push from someone who holds you accountable. And you do the same for them. Obviously, it's a two-way street. You don't want to be just getting all of the energy and they're just getting sapped and zapped and you're not giving them any energy or feedback back. So it's a two-way street, but get on with an accountability partner. I kind of just touched on it. If you can't find that in your accountability partner, seeking a group that is on the journey is absolutely important. That's one of the great things about the group calls that we do here. Talk about that in a few, but make sure that you can find a group or community of some sort that can give you ideas that you can pour into, that you can get things out of, that you can go for resources when you are feeling like, this just isn't working. I just don't have the energy to go out there and do the things I can do, I need to do. But I see, Bill's over here. He's doing it great in the community. I talked to Bill. Bill gives some encouragement. It's an accountability partner. He's part of my community. I'm getting off the couch. I'm going to get it done. Tip number 4, take regular inventory of where you are on your weight loss journey. While you're on these weight loss medications, it's absolutely imperative to not be the type of person that avoids taking a look to see where you are. You have to jump on the scale if you are trying to lose weight. It's impossible to know exactly where you are and what's working, what's not working if you're not jumping on the scale, if you're not measuring and remeasuring and changing and optimizing and strategizing. The strategy I had yesterday may not have worked, or I've had the last week. I've gone through a whole weekend and I tweaked something, and you know what? It's not working. Got to change it quickly, right? Got to optimize. Oh, I like that part of it. I like this part of it. I don't like that part of it. Let me try that. And you optimize until you get something that's working for you. And even then, it might work for you for a while, but it's not a forever thing, right? There's almost no fix that's, in your life that you're going to fix it once and never have to revisit. So always, always, always be taking inventory. If you're trying to stop, having a few drinks, more drinks than usual, you have to inventory that. You have to see, well, how many drinks did I have last night when I would have been in a situation and I would have had 10 or, X amount. And I'd had half of that. What did I do to get there? Who was I talking to? What situation was I in? What did I do to win in that situation where before I would have gone way overboard? So very important to optimize. You have to take a look and strategize and plan and make sure that you are taking account and being accountable to yourself for where you are in the journey so you can make changes early on and not wait months and months down the road when you're going to be frustrated with yourself. Like, man, I wasted all this time doing this and it's not working for me. And tip number 5, one of the most important tips, of course, I'm going to say that as a doctor, all of them are important, but tip number 5 is to check in with your health care provider before you start these medications. Now, that shouldn't be a problem because everyone here already knows you shouldn't be getting your medications from the lady at the dollar store. You should not be getting your medications from the ice cream man off the ice cream truck in front of the house. You need to be getting these medications from a reputable healthcare provider, right? To know that you are getting the right medications. If you're not getting the branded medications in the pen, you need to get compound medications from someone you trust. And that means going to your doctor, going to your provider, and getting medications that come from them. Someone they know and they've vetted and they have the absolute confidence that you are getting medications that you're supposed to get. Not only that, you should have an evaluation of your healthcare situation. Is it true that you have high cholesterol? Is it true that you have kidney problems? Is it true that you have heart disease? Is it true you have a thyroid issue? Is it true that your hormones are out of whack? Is it true that, whatever it may be going on, you should have an evaluation by your doctor before you start any serious lifestyle modification journey to make sure that you don't have an underlying comorbid disease that also needs to be handled before you start jumping out there and, doing laps in the pool and find out something's wrong with your heart. Very important to see your doctor for that reason. Lastly, the most important reason to see your doctor is to get counseling for the GLP-1 agonist medications. It's not just one of those situations where you can just get on the medications and it just magically works. You haven't been doing what you need to be doing for however amount of time, however many years to get you to the weight you're at. An unwanted weight, be it 30 pounds or 300 pounds more than you would like on your body, you haven't been doing what you need to do. Therefore, you need counseling, you need coaching, you need a session where you speak to someone who understands the physiology of the body, how these medications work, and how the mind works in bringing you to a place where you can make a lifestyle change, a lifestyle modification that is going to be long-standing. It doesn't make sense, and I'm going to be honest with you, especially these medications, who come out of this on the other side and come off of it, man, 2 months, 3 months, 5 months, 6 months, a year even in the trials, I am 100% sure those are the folks who did not take the opportunity to dive into the lifestyle modification part of the trial. All of these trials, every single one of them, be it Zepbound, be it Wegovy, tirzepatide, and semaglutide, respectively, all of these trials, they coupled not only the medication, they put the medication with lifestyle changes. People overlook the lifestyle change part of the trial. That part of the trial is absolutely important. Trials were just on the medications for weight loss and seeing how many pounds people were losing. All of these trials, every single one of them, coupled the medication. Some of them got to super high doses. In the case of tirzepatide, 15 milligrams high dose. Even the Wegovy got to 2.4 milligrams in respect to two different medications. So they have different numbers for their dosing. But the highest dose for semaglutide, 2.4 milligrams in their trial, and the highest dose for tirzepatide, 15 milligrams in the tirzepatide trial, both were coupled with lifestyle modifications. In many cases, they even added counseling. They told them exactly what they should be doing, what you should be eating, how many minutes to work out, and what workouts they should be doing, what types of macros they should be eating. And they even gave them the opportunity to speak to a nutritionist. So they got extensive lifestyle modification coaching. And one trial even had them go throughout the trial, not just at the beginning. They had access to the nutritionists and the lifestyle coaches throughout the trial. Great results. Now, the issue is afterwards, who actually dove into these lifestyle modifications and made it their own habits, not just to go through the trial and just, be there at the end and just hand in all your medications that you were given as a subject, but which I believe the subjects who did not gain the weight, or 2/3 of the weight that we saw that some people in the trial gained, those people who did not gain the weight are the people who dove in and made a lifestyle change. They weren't on the medication anymore, but now they've changed the way they eat. They've changed their exercise regimen. They've changed the way, why they eat, the how they eat, what they eat, and when they eat. They have an accountability partner. They're seeing their doctor more regularly. They're doing all these 5 tips. They've dove in headfirst into the lifestyle modification journey. And now when the medication was taken away, weight loss was continued or sustained at the levels where they left off. So those are my 5 tips to maximize your weight loss on the GLP-1 agonist medications. And talking about all this, now, I've been looking in the comment section and I can tell that there's quite a few folks who are on these medications, but don't seem to have a grasp of what they need to be doing. So they haven't had a counseling session or a lifestyle modification coach or anything like that to know anything about the medications and what they should be doing, what they shouldn't, how they should be taking the medications, how to even begin to count their total daily energy expenditure, calculating all the things that you should be calculating. We have that. Look down in the link in the descriptions, and we have our lifestyle modification coaching program if you want to join a group. If you think you need something one-to-one, give us a call and you can set up your one-to-one lifestyle modification consult with me, where we can take a deep dive into what you need to be doing with your medications. So, hey, we got it all here for you, and I will see you soon. Good luck.